once before, so this is the second time. My impression at that juncture, PMR with a typical presentation, a more typical response to methylprednisolone, but you have inflammatory myalgias, not controlled on 4, you need 6. No giant cell symptoms. Leflunomide decreased your visual acuity. We wanted to consider and try low-dose methotrexate, perhaps that would spare steroids. I didn't like your falling. I wanted you to ask your for a neuro consult. Okay, and then you called and said, hey look, I got severe pain in my hip. I assume it's the right hip?
Yes.
Okay, and I thought it was my back, but now it's my hip today. So how many days have you had this pain about?
This has been over a week.
And you didn't, right before that fall? You didn't fall on the hip or anything like that? Okay,
No.
Point to where the pain is with your fingers,
It is.
low back, and it goes down.
And it comes up. It's
Right.
like,
Mhm.
And you say it pops.
it pops
What pops, the hip or the back?
the back.
The back. So is it more back or hip?
Oh, it's definitely the
where
hip.
It's where you're pointing.
It's where I'm pointing.
That is the back.
Oh, it is?
You're corrected. That's okay. That's why I brought you here. This is why exactly. Everyone says the hip. Hip is groin.
Oh, okay.
All right. Oh, let me just. I'm going to rotate your hip. Your hip did not look bad. You had avascular necrosis on steroids, causing severe groin and hip pain and thigh pain. So that was a concern I had. Do you have any? Well, sit back for a little bit, gently. I'm going to gently rotate your leg. This is how I can check your hip. But I'm not going to do it quickly. I'm going to do it so gently. Okay. So this is rotation of your hip.
Right.
This causes no problems. Do you have pain going down the leg from the back?
I did start having some of that.
Where's it going down? Paint a picture with your hand.
Down in here.
Okay, sciatic type pain. Let's go back. You fell. Did the leg give way? This right leg give way? Now that
No.
It wasn't that made you fall.
No.
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 Ever have sciatica before?
Years and years and years ago.
Okay, when you fell and it hurt your knee, did you fall on your back?
You sat backwards.
Sat backwards.
So perhaps.
I went up against her and we eased her down, but you did set backwards.
Perhaps, okay. I'm going to need to lift up this leg gently. This is called a straight leg raising, but you're going to lean forward now. Does that cause pain down your leg?
No.
Toes up to your head. Pick your toe up to your head. Can you do that? Yeah,
No.
you're doing it. Okay, does that cause pain down the leg?
No.
Okay, it's
I
not. A little tight here?
Yeah, just a little tight behind here.
Behind. Okay, but not
Not in
reproducing
here.
the pain.
No.
Okay, now that we've got this back pain, does that limit your walking? When you're walking?
Oh, yes.
Okay, it gets worse. When you walk now that you've had this back pain, do you find that the leg becomes weak?
No.
Okay, so it looks like it's a pure sciatica. Okay, I'm going to ask you to lean forward. Okay. And there, it's the low back. Now, when you look at the x-ray, the hip is probably one of your best features. It wasn't bad, although you can miss avascular necrosis with the hip, but your hip is good, so that's not the problem. The low back has a lot of structural problems, curvature and a misalignment. I don't know when that misalignment occurred, but when you do, it can shear or press on nerve roots, okay? But also discs can. So this is a sciatica situation you've had for about 6 days now?
Yeah.
At least a week, okay. And you've had sciatica before, not really?
I mean, but that was after I had an automobile wreck.
So not for many years?
Yeah.
Okay, so suddenly you did have an accident. You fell how long ago when you hurt the knee?
Couple months.
2 months ago. Okay, so it could be traumatic. Let's look at those x-rays together
Okay.
for a moment.
Well, you know how to read them, I don't.
Well, I was hoping that someone here would.
I would too,
Oh
don't
my
worry.
God,
The only thing,
I brought you here for a purpose,
I
and
know.
now you're gonna fail me?
I know, well, here's the deal.
Okay.
Sally
You sound
has
like
told me.
Biden. You sound like Biden. Here's the deal.
Oh, God, I'm not going down that road.
Okay, so I'm just
You and
gonna,
I are not
I'm
going
gonna
to
leave
discuss it.
if you say, here's the,
We're not gonna discuss
no,
this issue.
And then if you end it with, come on, man, I'll.
I would never talk to you that. Dr. Greenberg,
Sorry.
I'm gonna have to have a conference with you on the side about this issue of your attitude. Okay, here's the deal.
Come on, man.
I'm sorry. Oh, Jesus.
When you best, you.
This is what Sally has told me, and everybody's telling me. When I walk now, I'm leaning over forward.
Yeah. Yeah, you lean over forward. I think you got spinal stenosis. Take a look here. I'm going to enlarge this and point out what we got.
Miss Sally, do you
You're
want to see
welcome.
this?
You're welcome to come over
Okay.
and look.
Because she'll explain it, my
Look at the
daughter.
vertebrae. Look at see. You got a lot of degenerative change, a massive amount. But look, this doesn't line up. This is really grade
Uh-huh.
2. So when this happens, you can irritate nerve roots.
Uh-huh.
Okay, that come down the leg. So this could be a. So let's see if we can find an old one. Now the one that they did before didn't. This was just a lateral view. Let me see if I can find an ancient lumbar film.
Oh, I bet you won't see one for years.
I don't care. I want one that's old, but I don't see it at all.
Mm-mm.
Yeah, we don't see. Okay, because then I could have compared it.
Yeah, no.
So I think I'm going to say you have a traumatic spondylolisthesis. You probably don't, but I'm going to say that and try to get an MRI. Now I'm going to also have to. I've got to have you come here physically so I can try to get that MRI. Insurance doesn't like to get MRIs. They want you to just let it, go to physical therapy, which you can't do like this. You're barely walking. Lift up this leg. Give me your strength. Weak. No, thigh up like this. Now thigh out. Okay. Hold it out. Hold it out. Toe up. Lift up. No, same way, like this side. Good. Hold it up. Toe up to your head. Okay. So I'm going to put your weak here. Positive straight leg raising. And I need to get an MRI. Now, your insurance may say no. Not medically indicated. They want 6 weeks of physical therapy. They want all,
Yeah.
that's how they do it.
Yeah.
I'm going to try to do it. I think this is a sciatica with some type of spinal stenosis. I think the nerve root that comes through is being pinched, okay, and the vertebrae movement is possibly aggravating it. So I'm going to try to get this as soon as we can. It'll also help us look and see if there's any fracture,
Yeah.
because you could have fractured when you fell.
Yeah.
So I'm going to put here fracture and traumatic spondylolisthesis and sciatica and spinal stenosis.
And then tell them that I'm dying.
They will not care.
Okay.
Okay. Just for FYI,
They don't give a flip.
actually they'll look and say, "Oh, she extracts medical care from us. Good, good.
Okay.
I'm sorry.
Then you and I have to come to an agreement.
Okay, what's that?
When they set the MRI up, I need to go to Palmetto Imaging.
I agree.
I need to go into the open.
Me too. Don't even argue because I don't even discuss it. I agree, 100%. Palmetto Imaging. I'll write Palmetto Imaging.
And they need to sedate me.
Well, sedation, we can give you a little Valium, you and I.
Yeah.
When it happens, you call up and say, I've taken 2.5 of Valium or whatever milligram, and then we'll call that in for you.
Okay.
But tell us the milligram that you could safely take. I don't want you,
Yeah.
not waking up, okay?
Well, I
So
don't wanna
you and I will do the sedation,
Okay.
and I'll write for that, okay?
So I feel so much better now that you can relate. Because I told Sally this morning, when I'm in those things, I feel like they're lowering the casket on me and I can't breathe.
I totally agree with you. That's where I get mine.
Can't do it. What?
Pain.
Okay, I probably need to tell you this. The only relief that I get is when I'm in the bed.
Yeah?
In order for me to be able to get up and move at all, I am taking 1,000 milligrams of ibuprofen,
Okay.
which I know is not good for the PMR. But the pain is so bad that all I do is cry.
Have you taken Tramadol?
I don't have any of that.
Okay, let's see what I can do.
But I just, to lift my leg to get up in my, what kind of car do I have? Is it an SUV? I don't know.
Hmm.
My right leg, I'm like, oh my God. I just about scream.
Give me a minute to put all this together.
Well, what's the deal here?
What's the
Now
deal?
listen.
No, here's the deal.
Oh
It's-
God.
Here's the deal. Come on, man.
Oh Lord Jesus. You're a mess.
No,
So-
you are.
So are you,
Well, I'm glad we have this working relationship to get me better.
Yeah, the problem is always the insurance. They're
I know that.
horrible. They're just, are you doing okay?
Mhm.
She's doing better than I'm doing.
Yes, sir.
And she has stage 4 cancer.
Are they making progress with it?
Well, I go for my 9th chemo Thursday and a CT scan, and I'll know then.
Oh, I pray for you.
Yeah, I have
Oh,
a
she
rare
has.
aggressive carcinosarcoma. Yeah, so.
But she,
But I'm doing
man,
good.
she's good.
Gosh, I just hope.
Oh, they are.
Tramadol for you. Hang on a second. Let me get the
That's
50
just telling me
milligrams
nicely. Shut up.
every 4 hours is needed for pain.
I'll take over. You know.
Tramadol, kidney function. All right, so I got a kidney issue. Not perfect. Let's see what I can do with that, or that's going to stymie me.
Man, I'm
You
telling
take
you.
Tylenol at all?
Yeah, I take
Arthritis, right?
Tylenol some.
Okay, let me see if Tramadol is.
But whatever you tell me not to take to compensate for that, I'll do it. I'll lay off of
Adverse.
everything.
Creatinine clearance. Okay, should be okay.
There's trouble in River City, and I haven't answered my phone, but they've been trying to call. I think they're locked out of the store. I don't have a key, do you?
I don't have a key.
Well, I didn't answer. I'm letting you know.
Get out of here, Sally. Who's there?
Well, Jordan's tried to call a couple times, but I'm guessing that's probably the problem.
She didn't show up.
Okay, I'm just gonna give you a dozen of these and see if this helps, but I don't want you to take a max of 4 a day. It's every 4 hours, but take max of 4 a day. Just because I don't want to overdo it here. Okay, and then I ordered that MRI.
Is that what I take? Tramadol?
Yeah.
You don't take have you had trouble with Percocet? What happened to Percocet?
Oh, I just started itching and all that stuff.
Can happen with Tramadol. Can happen. They can cross-react. So you want to hold off on that? Maybe smart.
You took it before, didn't you?
Yeah, I
You
took
took
it
Tramadol
before.
before?
Yeah, and it didn't bother me.
Okay. Put your mask over your nose. There you go. Because it's like not wearing a mask. I don't need you getting sick.
You know, to you two like he does me.
Here's the deal. Keep the mask on.
Here's the deal.
Sorry. So sorry. Oh.
Let's start protesting Dr. Greenberg.
I'm a little tired for that. You know, my violent days are over. What do you want to do? I want to get a few patients better, go home, take a nap.
Yeah.
That's all I want to do. Don't want to bother anyone. I'm sorry, I'm not up to your standards of violent protest, but
I don't have the energy. Maybe everybody in the world should have PMR and find out what energy level they got.
I just don't know what the answer is anymore.
I don't either.
Any of this stuff. I don't know.
I don't know either.
The September 24th, 2020 period, the patient recently fell on her knee and also sat down and hurt her low back period. She points out that she has right-sided low back pain that moves down the right lateral thigh. And she thought it was her hip, but in fact it was her low back period. We did lomosacrophones, and she has a significant grade 2 spondylolisthesis, as well as a great deal of degenerative change and osteopenia, period. The right hip only has mild osteoarthritis, period. She's on chronic corticosteroids for PMR, period. The patient can barely walk, period. She leans forward and she uses a cane to help, period. The patient describes that the pain is very, very severe, and years ago she had sciatica, and this is much more severe, period. She is unsteady on her feet at this point, period. Her leg has not given way, and this was not similar to the previous episode where her leg gave way in the past, period. Currently, no fever, mouth sores, skin rash, beyond bruising due to steroids, period. No new chest pain, shortness of breath, or severe cough, period. Appetite, bowel movements are stable, period. No COVID symptoms such as loss of sense of smell and taste, comma, severe congestion, flu-like syndrome, or sore throat, period. New paragraph. On physical examination, low back is tender on the right side with positive straight leg raising to 85 degrees on the right, period. The detent reflexes are not elicited bilaterally, but she is clearly weak on the right side with right thigh flexion, right foreleg extension, and toe dorsiflexion, weak, grade 4/5, period. The right hip has good range of motion and is painless to range of motion. New paragraph, impression, acute sciatica, period. I suspect she has a traumatic spondylolisthesis causing spinal stenosis and lumbar radiculopathy, period. The patient has significant osteopenia and very possibly has a compression fracture, which would be impossible to determine by simple x-rays, period. She needs an urgent MRI and she's claustrophobic. We'll send her to Palmetto Imaging, period. We wrote for low-dose tramadol, so she has some renal insufficiency, but I'd also like to give her some Valium after we've obtained clearance for the MRI, period. She is claustrophobic and she'll let us know when that is to occur, period. The patient is told that she does not need to stay on total bed rest since that can lead to a deep venous thrombosis, but it's very difficult for her to function at this point, period. Obtaining the MRI is urgent, particularly in light of the fact that she may have a traumatic spondylolisthesis, compressing her nerve root, period. Let me see, I'll have them try to get it today. I mean, not today, but get to work on it today if they can. Without bringing you in to do this exam, the chances of her getting an MRI ever are zilch. So I have to, put hands on for this.
You're right.
Yeah, that's why I did drag you in.
You're fine.
Told you, that's
I'm not gonna hit you today, maybe tomorrow, but not today.
good.
It's so odd, all these virtuals that's going on now. We're gonna become spoiled. That you... I'll tell you what I was scared about. I was scared I had fractured it.
You could have fractured.
And,
You could have fractured, not the hip, but you could have fractured the low back.
yeah,
Now, I'd rather fracture the low back than a hip any day of the week. But I was afraid of avascular necrosis. I was afraid of a lot of things. Also, shingles. You don't have any new rash. Shingles can do this. Can cause a sciatica type picture starting in the back. No rash there? Okay. I had a lady who came in with the same pain the other day, and then she sent me a picture and said, I was too embarrassed to show you because it was my buttock and she had a shingles rash. Yesterday came in, I said, well, we just figured it out. This is shingles causing sciatic distribution pain. So we were able to
isn't that
start.
wild?
Yeah. Well, but people are kind of funny. They're a little embarrassed.
Yeah.
And,
Well, Sally's had shingles before, and she was on her face, her eye and stuff, and boy, does that get ugly. Don't let me lose my train of thought. I want to ask him about if it's okay for me to take the flu and pneumonia or whatever inject things I need to protect myself. With, I don't trust him at all. If he ever retires, he's got to get his home address so I can just lay out on his front lawn. Let him come rescue me. Oh my God. Well, you got any messages?
Okay. What questions do you have?
Okay, what do you want me to do about taking flu shots or anything like that?
I would do flu. We usually like to hold the methotrexate for a dose or two after the flu injection. Did you start methotrexate yet?
Yeah.
Okay. It helps to build up the dose, but we don't have to build up the antibody level, but the antibody level may be easily sufficient even with the methotrexate. But since you're just starting it, I probably would miss an injection or two after the flu vaccine. Other vaccines that are dead vaccines, like the proposed COVID one, I would definitely do that. As long as it's not a live vaccine, you should be fine. I would take all the vaccines that you can. Yeah.
Okay.
So the methotrexate your antibody response is here. With methotrexate on board, it may bring it down to here. So we often miss a shot or two after it.
Okay.
Okay. So that's what we
Okay.
typically do. The steroid, we just keep the same.
Okay.
Okay.
Now, you know, I increased the medication to 8 milligrams.
I'm writing it down. I suspect that you would. Yeah. The medication is keep it at 8 for now.
Okay.
Keep it at 8.
That was the amazing part. When I took the 8, it relieved the pain.
A little back.
Yeah.
Yeah, it will, but I can't keep you on high dose steroid for this back. And
I
it's
know.
not a shot.
I know.
Not a shot.
I was just trying to find. I didn't know if I was having a flare up or what.
What's the methylprednisolone? Get rid of that for. Someone took it off. You're taking Medrol 8, is that correct?
No. Give me that bag.
When you say 8, is methylprednisolone?
This is where all this gets so confused. I take too many different drugs. Yes, I'm taking methylprednisolone.
Yeah, the 4 milligram pills,
Yes, sir.
correct?
Yes, sir.
That's what we got here.
Okay.
Do you need any more?
Yeah, I'm gonna have to have a refill.
Okay, I'm gonna say take 2 of them.
Okay. Because I don't want to go up. Came too far. Ugh.
I'm gonna call that in right now.
Okay.
Okay, all right, let's go outside and I'm gonna talk to Tammy about getting you this MRI.
Okay.
I'm gonna tell her, come out imaging.